One of the things that we found out statistically is that clients that have spouses in addiction, the spouses end up being victims because of the behaviors of the clients. We highly recommend that the spouses go to Nar-Anon or Al-Anon meetings so that they can understand about the disease concept, but also understand the behaviors that they have witnessed through the years of witnessing addiction in the families. Spouses sometimes don't understand the disease concept, so through the Nar-Anon or Al-Anon process, they get a chance to be in a support group with families that are dealing and struggling with the same issues. Spouses also are encouraged to attend a weekly family session so they can understand the process and the progress of what their spouse is going through their treatment plan objectives, but also understand the dynamics of how the treatment process works, the aftercare process through case management and aftercare, so that we can give the best quality of care to a client and the spouses involved through the whole process. During the treatment process, spouse can be very, very supportive or very, very detrimental based on the codependency or the enablement process. The benefit that they can be in this process is to allow the client to get the most out of their treatment process with their therapist and with the whole treatment curriculum, and allow the spouse to interact only during the family session time. We find out that spouses that are very codependent can be very detrimental because of the behaviors that they have witnessed in the past that counteracts with the behaviors of the present time of what the client is doing in treatment. One of the things that I've seen in years of being in the field is that clients that have spouses that are not familiar with the recovery process tend to sometimes be a detriment to the recovery process because of the lack of knowledge of the disease concept and the recovery process with Narcotics Anonymous and Alcoholics Anonymous, Cocaine Anonymous, or whatever anonymous it is. One of the things that I truly like about the things that are going on in the 21st century is that we have a gamut of different entities that will support the client in beginning the best quality of care that they can possibly have to have a successful recovery. I completely understand why family sessions are so important to make sure we engage the spouses in the treatment process and to allow them to understand how to interact once the client returns back to the family dynamics. Most of the time, we have clients that come from very toxic, unhealthy relationship situations, and while they're in treatment, we try to give them all of the healthy coping skills that they can use to go back to regain a healthy relationship with their spouse. One of the ways a spouse can be very helpful in the treatment process is to really allow the client to do their treatment without any distractions or interferences. A lot of times we find out that spouses can be very interactive in the treatment process and kind of can be a distraction for the client with outside issues such as family and children and finances. So what we try to do is we make sure that the client that's in treatment can stay focused on the endeavors that they're really in treatment for, and try to limit as much as possible the outside distractions. One of the ways that they can be a detriment is being too hands-on in the treatment process, especially when they're not knowledgeable of the disease concept, they're not knowledgeable of how recovery works, and being too hands-on in there can be extremely detriment. That's why we have the blackout rule, where the first 7 days they're in treatment, that they're not able to contact anyone on the outside world. That way they can get their feet grounded into treatment and start beginning to deal with the core issues that has led them to active addiction for so many years. One of the dynamics that is very detrimental to a client while that are in treatment is when they have a spouse that is very unsupportive in the treatment recovery process. For example, you have a wife that has a husband in treatment that has left them with to tend to the bills and tend to the kids, to tend to the normal vicissitudes of what a family operation is. Normally that spouse ends up being a very big distraction in the treatment process. So one of the things that we try to do is to make sure that the less distractions as possible will lead to a successful recovery. We try to encourage our spouses to stay in touch with their therapist. Do not make any rational or irrational decisions without consulting the therapist, to make sure that we're all on the same page to give the client the best quality of care while they're in treatment. With that being done, we have found statistical data that states that a client has the best successful chance of being staying clean and sober for a long period of time, if they follow the protocol of how to have a successful recovery while in treatment. Being supportive in the treatment process and the aftercare process is very a key dynamic, because most spouses they discharge back to the family without having any aftercare plans because of the pressures that they've had from the spouse while in treatment to get back home and try to be supportive with the children and with the finances. So what we do is we try to set up a successful aftercare plan that is going to allow them to continue to have intensive outpatient treatment with a support network in the area, in the community that they're going back into, particularly get them involved in 90 and 90 meetings, 90 meetings in 90 days, a therapist, a sponsor, and some sober supports to help them along in the discharge aftercare planning.